So I can start with some announcements. So we have elections, and there are two positions available. One is my position of co-chair. The other one is the secretary position. So I have a document that actually I can share, so you can see what is that about. To be in my role is really great. So I'm just going to tell you all of them to consider applying. This is my second year, so I'm getting out, and Rachel is going to stay, and you will join Rachel as a co-chair. And here are some of the requirements. For the co-chair responsibilities, you have to attend no less than 75% of the SIG meetings, draft the agenda items, run the meetings, serve as the liaison with the CFHA, other teams on the board, and also, be a direct line with the presenters who are coming to present for that month. Also selecting topics and thinking about what people are interested in hearing. And the secretary responsibilities is 100% of attendance to the meetings, or in case, for some events you cannot attend 1 month, just finding someone to cover you in the team. Take the minutes at the meeting and send out the meeting reminders to the SIG members and participants. So it's really great to be part of this team. I have a lot of fun and also feel really supported, and I encourage everyone to think about it. If you're a participant that is here most of the time, you might as well consider joining the leadership team. So email me or Rachel if you have interest or you have questions, and we can answer those and take you, the right direction for this. Now stop my share, and I think we have Amelia with us already. Hi, Amelia.
Hi. Did you want me to go over all the wonderful things that were suggested at our last meeting, or talk about?
I think we should do that first, and then we'll move on to the research corner.
Sounds good. All right. So for those of you who were at our meeting, lovely suggestions. For those who weren't, I'm just going to kind of go over some of the general things that y'all asked for when it comes to future meetings. So we talked about provider wellness. There was topics like self-care, self-compassion, things like that. Resources was a theme. Many people are talking about resources for rural settings, telehealth and pediatrics, digital or tech apps that people are using. BHC in a preventative manner, so talking a little bit about like how to provide preventative services, how to get started in areas where the behavioral health well child check isn't a thing yet, how to start moving in that direction, prevention for like higher elementary ages, and just some general guidance for different age ranges. There was a request for some fact for children, specifically maybe Patty Robinson, talking a little bit about pediatric MAs and having an MA and how do you utilize an MA in a behavioral health setting in your organization. Social media and technology in general, how to support adolescent males, sports and social media health, specifically talking about like eating disorders in sports and athletes, kind of maybe diving more into some minor rights and navigating health systems when there's different minor rights related to behavioral health. School-based health was something that was requested, research and mentorship programs, how to get pediatricians or other medical providers engaged in conferences, having a directory of members, productivity and data tracking, and then some policy questions about like how things are changing, specifically around that behavioral health well child check and how to like advocate and do those things in other states and be an advocate in your area. So lots of really great ideas. I'm super excited. If you have further ideas, I'll throw my email in the chat and you are welcome to send them to me. We would love any ideas that y'all have.
Thanks, Amelia. So
I'm happy that people want to have ideas for how to support behavioral health and well child checks, because that's what I'm excited to talk about in just a moment.
So I think now you can put your ideas on the chat or I'll mute. We are fine either way. And now we are gonna start with the research corner. So Jonathan.
Hello, everyone. Nice to see you all. So let me go ahead and share my screen. Adjust this. So today we'll briefly touch on 3 articles. I'll do my best to cover the main takeaways, especially the first 2 that are more review policy statements. And then the third, I'm glad to see Dr. Hammond here today, who will likely talk about this more, but just briefly touch on the outcomes of that study. So the first was leveraging the biology of adversity and resilience to transform pediatric practice. This review basically talked about how advances in science have provided opportunities to develop a deeper understanding of healthy development, and more specifically, a more integrated whole child approach to the biology of adversity and resilience. It discusses promising new strategies will be required at both how promising new strategies will be required at both the individual program level and the system level to achieve greater impact on the early roots of disparities in lifelong health, and how primary care pediatrics should be the science engine driving this agenda. In terms of practice level change, it discusses how the biology of adversity and resilience points to 3 guiding principles that can inform both improvement of existing practices and the design and testing of new strategies. The first being to support responsive relationships, relationship-focused coaching, promoting safe, stable, nurturing relationships, managing perinatal depression, fostering male caregiver engagement, partnering with home visiting programs, encouraging developmentally appropriate play, discouraging screen time, promoting shared book reading. The next, to reduce sources of stress, interventions that lessen economic, psychosocial, and health burdens on families, increase adult bandwidth for providing positive caregiving, financial supports. The third, to strengthen core skills to provide a well-regulated caregiving environment. And then also discusses how there's this growing interest in biological measures of stress, activation, and adaptation in young children, and that can be promising, but more scientific validation and preparation is necessary. It further talks about how during the importance of the prenatal period, developing brain, immune system, metabolic regulation underscores 2 critical roles for pediatric primary care. The first really being to enhance connection to prenatal services, and the second to develop more effective strategies to address adversity in the first 2 or 3 years after birth, and to answer questions such as what works for some children and in what contexts, and maybe what is not working for others. In terms of population level change, more attention to the biology of adversity and resilience in medical school and residency training programs, increased attention to the influence of racism on the delivery of healthcare services, stronger evidence, more robust measures of impacts of effective practices that require potentially longer to deliver, and therefore that evidence would strengthen the case for the payment of longer visits and expertise in value-based reimbursement policies to secure its sustainability. And while greater attention to social determinants of health is essential, the identification of increased risk must be followed by the implementation of effective strategies that produce measurable effects, such as direct measures of child health and development within the context of primary health care to determine priorities for intervention and match specific services to identify needs. Let's see. It also talks about how, we're on our next article. So preventing childhood toxic stress, partnering with families and communities to promote relational health. This policy statement discussed how, basically preventing childhood toxic stress responses, promoting resilience, and optimizing development require that all children be afforded SSNRIs or afforded safe, stable, and nurturing relationships that buffer a wide range of adversities and build the foundational skills needed to cope with future adversity in an adaptive, health promoting manner. And it's based on 3 science-informed principles to support nurturing relationships, reduce external sources of stress on families, strengthen core life skills, the same 3 principles before. And this article discusses how it provides a framework for developing innovative strategies to promote at the dyadic level, family level, and community level. And again, I encourage everyone that's interested to look into this article for further details, but really I just put the core principles here. And for translating these principles into pediatric practice, that would require to understand the toxic stress framework, understand the relational health framework, foster strong, trusted, respectful, supportive relationships with patients and their families, with community partners, acknowledge the wide range of adversities, embrace an eco biodevelopmental model, and to really move beyond the singular approach to a layered interventions that are integrated both vertically and horizontally. And again, I apologize for just touching over all these things, but there's a lot of information in these. And then next is to become hubs for medical neighborhoods. And lastly, really to advocate that health systems, payers, and policymakers at all levels of government align incentives and provide funding to promote the universal primary prevention work discussed in this policy statement. It also talks about how to develop the physician leadership of the future. And that again is to educate residents about the eco biodevelopmental model, provide longitudinal experiences to train residents, teach residents on how to identify and develop collaborative relationships, and prepare residents to work as part of the interdisciplinary teams that transform these hubs into for medical neighborhoods. There's also two more. Educate residents about the many facets of a fractured childhood system of care. Encourage them to become leaders in interdisciplinary early childhood systems. Basically covers that. And then I'll just briefly touch on the outcomes of this outcome evaluation on the online Keystones of development curriculum across 8 pediatric residency programs and 67 pediatric residents. It found at 1 month post-intervention, increases in behaviors that promote positive parenting, discussing modeling, and praising at 0.05, but still, significant improvements, I'd say. Changes in secondary outcomes, knowledge, perceived behaviors, and self-efficacy. And then how qualitative interviews revealed that the integration of curriculum content into clinical practice was due to the relevance of the material to primary care, and that the modeling of how to apply in the clinical setting, curriculum format, content, and clinical application helped participants weave recommendations into the well-child visit. And I guess the overall conclusion would be that the online Keystones of development curriculum is promising, and it increased resident behaviors, knowledge, and self-efficacy, and decreased perceived barriers to promote parenting behaviors associated with improved child development outcomes and well-child visits. And there we go. Thank you. And I'm sure Dr. Hammond will be happy to answer more about this article. Certainly.
I sure will. Thank you.
Yeah, thanks, Jonathan, for that kind of great summary of those articles. I think you really set the foundation for Dr. Hammond's presentation and starting to talk a little bit about the data behind this Keystones for Development curriculum. So without further ado, we're going to welcome Dr. Blair Hammond. She is the co-founder of the Mount Sinai Parenting Center and also the Director of Medical Education. So we're excited to see your presentation today. Thanks for joining us.
Great. You all see this. Is that working? I apologize for all the tabs above. Okay, great. Thank you. Thank you for having us here today. So I am excited to talk about promoting early relational health and child development in the healthcare space. It seems so relevant to all the things you were just talking about. And as you may or may not know, the Mount Sinai Parenting Center, actually, the mission of the center is really to transform the way pediatric healthcare is delivered by maximizing the many opportunities to promote strong parent or caregiver child relationships and early childhood development within our everyday healthcare interactions. And I hear we're even saying like some medical assistants, and how do we change the whole space and all the people in that space? And we try to create free, scalable resources that are for everyone, recognizing that we think this is something all families deserve to have, and it is part of great healthcare. And one of my favorite, let's see if this will click forward. One of my favorite things to share with families, as I'm a general pediatrician, and I round in the well baby nursery, and I always love to talk with new families about just how much brain development there is in the first few years of life. You probably all know this, how there's over 1 million new nerve connections made every second in the brain. And one of my favorite things to tell families, I'm like, and you are your baby's favorite toy. It is your voice and your face and your touch and your smell that actually helps build your baby's brain based on the science. And I think a lot of us who've rounded in the nursery for years and care for patients, it was always like, don't shake your baby. And you better put them on the back so they safe sleep so they don't die. And it's telling people what not to do, which is sort of counter to how we say parenting should be, is tell people what to do. And how do we have a strengths-based approach to this that hopefully, again, reaches all families and really becomes part of what is healthcare for children and families. Hilarious that the next slide is what Jonathan just showed, that we like to say that the AAP has made this statement that safe, stable, nurturing relationships are biological necessities. They're not nice to haves, they're must haves, because they mitigate this childhood toxic stress and they proactively build resilience. It goes on to say, like, how are all the different ways we're going to do that? And that's really where we try to think about, like, how do you infuse this science of early relationships and positive parenting behaviors and social emotional skills and numeracy, literacy, executive function skills, language, all this stuff into the healthcare space. And I think it even commented on in that article, and I was like, I do not have this training. When I was like, no one, I didn't skip lectures. It wasn't like I was ducking out of stuff. I felt like it wasn't part of our medical school and residency training to learn about this. And then it's like, and in some programs, like in my program, we had like a part-time quasi behavior and developmental specialist. Like, there's not even necessarily experts at all of these institutions. And how do you standardize it? How do you give resources when there's so many other competing demands? And I will be the first to say, my disclosure is, number one, I made up parenting advice as a resident. Number two, I find it hard to practice what I preach as a parent. And number three, it is hard to fit in all there is to fit into well-child visit, but it doesn't stop me from aspiring every day to do more. And so it's like, how do we get it in a really practical way that actually can get woven in to the healthcare space? Because the truth is, if you want to have classes, guess what? People don't show up for classes. And if you know what I mean? So it's like, how do we do it in the moment? And that's where we really started to think about, all of us have our moments with families, right? In the healthcare space, the front desk, the MA, the nurse, me, the social work, we all have our moments. And what if we really thought about using our interactions, hopefully, to strengthen that caregiver-child interaction, or to share some nugget or model something or praise, observe what you're seeing in the room, recognize it and celebrate it, right? If we could bring that in. And so we went about thinking about, how could we create resources that we could actually scale and share with everyone? So we started by creating an online curriculum that you just heard about, the Keystones of Development online curriculum, which is now used to train, 190 of the 210, almost 190 of the 210 pediatric residency programs. And now actually we're doing family medicine, and we're trying to look at nurse practitioner programs and stuff. And this was an online curriculum, really getting at the idea of, like, we as residents, trainings, and pediatrics, like, how do we learn the information about promoting safe, stable, nurturing relationships? And I'll go into a little more detail on that in a moment. And then the curriculum got a lot of traction, and I was trying to weave it in my visits. And I said, I love this curriculum. It's changed how I do things. I am always thinking, what am I discussing? What am I modeling? What am I recognizing and celebrating in the room? But sometimes the patient has bad asthma, or there's an issue with housing, or there's other stuff, and it doesn't always get said. And so it's like, how do we have a safety net thing to make sure that all parents hear this key information? And so we created the Sparks Parent Video Series, which is available in English and Spanish, and I'll go into that in more detail too. But that's sort of direct to parents, but also I use it to train residents. And then we also thought, like, the newborn period is just this special imprinting time. And a lot of families are in the hospital and have a moment to watch something. So how can we create a video? Which of course we're going to cover the medical things like how often to feed your baby, how many wet diapers, etc. But also the science of that early brain development and the importance of caregiver behaviors. And how can we give hopefully more knowledge to create less stress? And again, how can we also think of using that video to help train residents too? And okay, so these are our resources. Can you just raise your hand? Has anyone here seen the Keystones of Development curriculum? Am I like talking about something that everyone's like, yeah, duh. Okay, cool. Oh, Lisa has. Okay, awesome. So just to give you a little background on this curriculum was developed based on actually 6 keystones that we came up with: secure attachment, autonomy, self-regulation, perspective taking, problem solving, and academic knowledge. And we created, it's about 4 hours. It's a self-directed online curriculum, and it integrates the promotion of positive parenting behaviors into routine well-child visits. And we chose these keystones because they are largely supported by research. They are largely dependent on parent or caregiver behaviors. And hopefully they're able to be promoted through teachable moments and strongly predictive of later well-being. There are these 3 sections of it, which is a little blurry, I now see on this big screen, but there's the introduction section. And then there are 6 modules called the exam room section. And those are broken down by age. So you'd have 0, 1, and 2 months, 4, 6, 9 months, 12, 15, 18 months, up to age 5. And it really starts by giving you definitions. And then, and I will say we created this curriculum because we used to give lectures to the residents, and this amazing developmental psychologist who co-founded the parenting center with me, Lisa Pressman, would give these lectures to the interns during behavior and development. And they come out and be like, how amazing was that? And they're like, oh my God, so amazing. She said so many interesting things. I was like, okay, what are you going to like put into your visits and stuff? They're like, no idea. It was all amazing. I have actually no idea how I would fit it in, but she's amazing and she should talk to some of these people. And so we really tried to map out like practical ways you could actually weave it into the visits. And then we have the classroom section, and the classroom section is actually the science behind each of the keystones. And it talks about studies like in attachment. It talks about the Minnesota longitudinal study, and it has Dan Siegel talking about attachment relationships. And it goes into the science of it. And then it reminds you at the end of, again, all the different ways you might promote attachment at different ages, and how attachment might be skin to skin in the newborn period, but in the 2 to 3 year old period, it might be avoiding shaming with toilet training and stuff like that. So we tried to have it like that. And then there are lots of other resources that I want to show you in just a moment. Just because I thought people might not have seen the curriculum, do you want me to just play a minute or 2 of it so you can sort of get a sense?
That would be great.
Okay, so this is the clip I'm going to show you at first is from the 0, 1, and 2 month old visit, the exam room part, and then it so it talks about definitions, then I sort of clip it, and it talks then about how you can weave it into visit, and then clip it, and then it shows you Dan Siegel talking, and we'll cut that short because you all know that stuff. Okay, so let me figure out how to hit play.
Speaking in parentese means using a sing-song voice with real words and using appropriate grammar. Studies show that using exaggerated facial expressions, stretched out sounds, and clearly articulated sentences helps children learn language much more easily. Parentese is not the same as gaga goo-gooing, but mimicking a baby's actual sounds is also really important. Sportscasting is just what you think it is. It's a play-by-play description of exactly what is happening moment by moment. just like a sportscaster on TV. This gives you an endless supply of things to say, and the infant will hear new words and begin to learn how to communicate. Like feeding, diaper changes are also a frequent activity in an infant's day. By using parentese and sportscasting during these early moments, you can model for families how they can promote language development and strengthen parent-child relationships. In the first 2 years of Jaden's life, you will change an average of 5,000 diapers. Yeah, it's a lot. But each diaper change is also a great chance to talk to and connect with Jaden to help promote language and strengthen your bond. Hi, Jaden. I see you there. Your mommy and I are talking about you. Hi, and I are.
You get the idea.
You know, lots of exaggerated expressions. I noticed you do it naturally when speaking with Jaden. That's great. That's exactly what you should be doing. This type of voice is called parentese, and it's actually been shown to help babies learn language much more easily. When you respond to his smiling and his laughing and cooing with back and forth conversations, he'll start to understand how language actually works.
The relationship, the way parents communicate with a child, the way they tune in to what's going on inside the child, not just what's going on externally in their behavior, but what the child is feeling and thinking, what's happening in terms of the child's mind. When a parent tunes into that, the child develops all sorts of fabulous things that will help this child grow as you watch them grow into their later childhood years, into their adolescence, and studies even show into their adulthood. Now, the absolutely mind-boggling reality is that the experiences parents provide not only shape, number one, the structure of the brain and its regulatory functions, but number two, actually shape the epigenetic molecules that will come to regulate gene expression. So we don't say genes versus experience anymore. The versus is now and. It's gene.
You get the idea. And I don't know if you want to see, like, we also show an example of, like, if a parent or a caregiver has a question, how the resident or provider could respond to it. So I'll show you, like.
So I'm going to go through some normal concerns at this age, but before I start, is there anything you're concerned about today?
She's been screaming a lot lately when she doesn't get her way, or she has a complete fit out of the blue.
I know it can be difficult to have your child screaming and crying for what seems like no reason. The good news is, it's normal. Kyla doesn't have the words to tell you what's wrong, and she doesn't have the skills to solve problems. Yet. So, she gets very upset and has a tantrum. When this does happen, it's important to remember that Kyla is too young to be ignored or disciplined.
Okay, but then how do I get her to stop? She just keeps doing it.
For now, during a tantrum, she just needs you to name her feelings and comfort her. It's hard for her to hear when she's upset, but you can help her begin to understand her emotions by labeling them, like, I see you're mad, and then offer some perspective like, I know you wanted to keep playing with that toy, here are some other toys you can play with. To decrease tantrums in the future, it's helpful to tell Kyla what you want her to do instead of what not to do. These are called positive opposites.
Anyway, you get the idea. So we have this whole curriculum. It is now available on an app. We actually did a study of preceptors, training preceptors in residency continuity clinic on their thoughts about, we did a sort of abbreviated module on it, and they said that it was so valuable that they thought it was helpful for all providers to have. So we now have this available. Any provider can have access to this. There is now CME credit on, in addition to just the courses, there are also parent handouts available in English and in Spanish, and actually 11 different languages if you have other needs. We print these up in our clinic and have them on the front and the back side. There's also a tip of the week, because we feel like we all need a little booster shot when we're busy in RSV season in particular, to remember to discuss these different things. So we have that with this curriculum too. Based on resident feedback from our Keystone study, actually, we have the Caring for Your Newborn video that's available on the platform, and also available for families to view in English and in Spanish. It's a 35-minute video. It has over 1.6 million views, but we created additional modules on discipline, sleep, and toilet training, and they also have handouts related to them for families. And then, this is where it's at. We have 189 pediatric residency programs are currently using them. 273 family medicine medicine programs, and over 17,000 providers. And our real goal is to share this resource with as many providers who may find it beneficial. And again, we also now have created the Sparks videos. These are 8-minute videos. These are different. These are not animated. These are targeted to be like direct to families. They discuss age-related topics like nutrition and sleep and safety and common parenting challenges and behavioral issues in ways that we hope promote a child's social, emotional, and cognitive development and the parent-caregiver-child relationship. This has a different format where there's sometimes parent testimonials, there's sometimes groups of parents talking about things, and there's an expert talking about it. We try and have clips that really show caregiver child interactions so that you almost see it, and you really feel it, because sometimes it's hard to always demonstrate what you mean. And I have to say, some of the older visits are like my favorite visits, and I apologize, I'm showing just a classic one from the newborn, which is sort of similar topics, but there's one that talks about like your inner voice, how you are your child's inner voice, and finding the calm, and the idea of co-regulations and how emotions are contagious, and really just such, I think, valuable information that, again, it's hard to get that all covered in a visit when you have so much else going on in a visit. So we think of this as a safety net, sort of bringing to life what like we think Bright Futures hopes to do on this stuff, but like really make it tangible and connecting with families. I want to briefly just show you, again, this is from the newborn module. So there's one for each of the well visits. So they're 14 over the first 5 years. So this is the first video after they've talked about feeding, and like, I didn't know a baby slept so much, and how often to wake a baby, and what, how to day nights type of stuff. And then it goes into this section called Connecting with Your Newborn.
Connecting with your newborn. It can be challenging knowing how to connect with a newborn. They're small, they seem fragile, and all of this is new to the both of you. But building a relationship with your new baby is less complicated than it may seem. Things you're probably already doing, like talking with them and responding to their needs, can have lifelong positive impact. Right now, it's all about observing and just getting to know your baby. It's amazing how much brain growth occurs in the newborn period. Over 1 million new nerve connections are made every single second. And research shows that your relationship with your baby really helps build these connections in their brain.
Okay, it goes on. But then we also have additional resources for incorporating into practice. So like we have electronic medical record templates. So for all of the handouts, I have them now. So they're all smart phrases in Epic. I have a hyperlink that gets sent to my families in advance of the visit that has the Sparks videos. We also have Sparks flyers. We newly have these cute Sparks stickers that can go on things, and on my phone, my Sparks phone wallet with the QR code. Again, the handouts we have in our rooms and in our resident conference rooms. But we do have this portal. We would love, our goal again is share this as widely as you can with as many people as you think may find it relevant. On the portal, it has the Keystones curriculum, it has the newborn class, it has the Sparks video series. It also has this thing called Vroom in Healthcare, where we do monthly staff training. Anyone can sign up for it. And all members of the staff can attend these meetings where we talk about like, what's your moments with families? And we talk about like, what's the science of early child development, and what are behaviors, and what's one thing we might do differently based on it. And we talk a lot about how instinctively we do a lot of things that are great for building caregiver child relationships and child development. But how do we go from just instinct to like intentionally and consistently doing it, because we know how important it is in sharing that information with families. We have parent handouts, and we have KeyNet, which is just a research collaborative. If they're residents or people who are interested in doing research projects related to the stuff, that we try and support it and, fan the flames to help get things going. And again, this is the QR code if you guys want to access our provider resources. If you have any questions, that is our email. And I apologize that I don't have much time. I have 3 minutes for questions, comments, anything.
Thank you so much, Dr. Hammond. This is a great presentation. So let's go ahead and open it up. Questions, comments that people have. Feel free to also put your questions or comments in the chat. So
just a little testimonial to say that.
Oh, we can't hear you, Lisa.
We could hear you in the beginning, but suddenly it went silent.
Uh-oh.
Oh, maybe it worked again there.
That was me. That's okay. Feel free to put it in the chat, but it sounded like you were going to say something really great as a testimony to this work. So thanks for that.
These are awesome.
Go for it.
No, I was just going to say I have issues with technology all the time, so I'm highly empathetic.
I was gonna say these are great resources. I was wondering like if part of the portal has like the information to do that smart freeze with Epic, because I'm in a different system, but that'd be awesome to just have that on file to put as an Epic phrase if that's something that we can access. Like with the sparks and everything.
So if you go into Sparks, it has resources, like you can print out the flyers, you can print out the stuff there. If you need to be walked through, the one thing is, and we're hopefully talking at least to one, if not more, electronic medical record things to have it as an option that you can select for all this stuff to be in there. But currently you have to create your smart phrases. We can help you do that, and Sinai has that, like the list of all the smart phrases, and this is how we then put it in if that would be helpful for you. So we can also do that. The other thing is with the app, you can airdrop the handouts, drop the videos. And then what we have in my office, we put the flyers up so they get it also at the front desk for the Sparks for the QR code. And then it's also in the room. So after the medical assistant screens the patient, it's like watch while you wait is what it says on it. And they do that. And now we have these new things also to put on the computer. So people are like, that's Sparks, that you can put on the back of the computer for them to download the QR code. So hopefully that helps. And we also have all the handouts for like toiletry and sleep and discipline type modules too. Other questions?
Wonderful.
If anyone has any questions, please, by all means, reach out.
So Dr. Hammond, we have more I don't know if you have time, if you need to leave the meeting, but we have at least 20 more minutes to kind of discuss, but if you need to go, that's fine too.
I have patients at one in an office that's like a few, like 7 blocks away. Sinai can stay on and answer a lot of logistical, any questions and how it's been integrated. She speaks to programs all the time. She's amazing. But I probably have 2 or 3 more minutes if anyone has any other questions.
I will jump in if nobody else does while we have you before you go. You gave kind of an example earlier, I guess in the video, just thinking a little bit more about how residents kind of weave in this curriculum, and you kind of talked about teachable moments. And so above and beyond maybe just like the EHR, or like, are there prompts? Like, how do you kind of teach residents to, let's talk about parenting today, and not make, and maybe a kind of fluid way? I mean, what's kind of maybe another example or way that you handle that in your training?
Well, we do have all of the residents watch the curriculum, which really goes through how to do it. And they do that during their behavior and development rotation because they have more time on that rotation than actually in their outpatient ambulatory rotation. But they weave it in usually in their continuity clinic. And we have an orientation session where we sort of set the stage of like, is there anything you're doing to help promote like early childhood development and relationships? And they all say reach out and read books, and we're like, yes, by the way, reach out and read also helped create Keystones with us. I should have mentioned that. And then we talk about the science and whatever, we have them watch it, and then we have them come back and present a case. And we actually have also created an observation form, which we use sort of as a reflection piece. Actually, we created it with the Reach Out and Read community. And instead of being like, washed hands, check that, check, ask the family history, ask the social, it's like establishes connection. And like, how do you, like during the physical exam, are you labeling the child's emotions? Are you examining the child in a position of comfort? Like, giving choices when possible. Like they're all these little, we try to have like these little things that you can do in the moment, in the room. And so we have them reflect on the observation form, and then we have them each present cases, and we talk about it, and we really think of it as opportunities. And when I think about where I was, like intramural residency, I mean, I don't think I could really hear a murmur unless it was like a 5 out of 6 murmur. So there's so much that they're learning, but we're trying to have it from the very beginning to recognize. You walk in the room and you observe the caregiver and the child, and you find a strength there. And you build off of that, and you recognize that caregiver-child relationship as something absolutely crucial for that health of that child, and you're going to help support it. And so it's sort of that mindset. And then there is, I say, it's sort of like dance moves. And then I actually have been giving also lectures related to Sparks videos, where we sort of I'm like, what do you typically do in a 4-month-old visit? What are you talking about? What are they doing developmentally? Okay, let's watch this Sparks videos. Okay, now I want you to think about, what are you already talking about there? What's something new that you learned? Anything you're going to do differently? And then sort of like, how do we go through the dance moves of fitting it all in? And what might you observe the baby doing? And what might you talk about? And when you talk about solids, how might you do it, etc. So we're trying to find all these other ways to reinforce it. I do think, you do the curriculum once, the handouts help reinforce it. So we say, bring the handout in with the book, pick out one thing you're going to emphasize to talk about. And it is something that you have to keep practicing to get sort of more of I think we say it's like opportunity exists, like an opportunity for growth, an emerging skill, and an established practice. And to get things to be an established practice takes a long time. But how do we start that journey in residency? Did that answer your question?
It did. That was wonderful. That's great. I love the prioritizing the relationship and having them practice and talk through, and it's kind of an ongoing learning for the residents. So thank you so much. I know you got to go.
You're welcome. It's
Wonderful.
my pleasure. And as I say, what I also say to residents, I was like, it's not just early relational health, it's relational health. And it's what prevents burnout. And it's what makes medicine special, like having the relationships with these families. So I hope that it also, helps fill their bucket and helps them find the joy and what's so amazing about primary care, hopefully. So
Definitely.
Hopefully these things
Well
happen.
said.
If you have any questions, please reach out. We would love you all, share again. Oh, I think there may have been questions. I'm not even looking at them. Oh, thank you. Thanks, guys. Oh, thank you for sharing that, Sneha, too. I apologize that my schedule is so crazy on Mondays.
No worries. We're happy to have you.
Thank you so
We'll
much.
keep the
All
conversation going.
Okay, perfect. Bye, everyone.
Bye. Thank you.
You're welcome.
Awesome. Well, Sneha is still here, so we can talk logistics. We can also open it up. People want to talk more about some of their positive parenting, interventions, things like that.
Yep, I work at the Mount Sinai Parenting Center with Dr. Hammond. I did share some resources in the chat, which can also be found on the provider portal as well, along with other resources for faculty, preceptors, residents. There's user guides, there's flyers that can be posted up in office space as well. But I'm happy to answer any questions.
Thank you. Well, one easy logistical one I had, and maybe Dr. Hammond set it, how do you, if we wanted to use the resources, how? I mean, is it free? Was it, yeah, I saw the QR code. Is that how you get access? What's the process?
Yep. Great question. Yeah, everything is absolutely free. It always has been, it always will be, with the resources for providers and for families as well. So if you want to create an account for yourself, you can do so through that QR code or the link that was shared earlier in the chat as well. If you are working with residents and you want to enroll your program, or you don't know if your program already has access to the resources, feel free to share your email in the chat and I'm happy to connect with you and let you know. There are some programs that might already have access, and residents may not be involved or might have dropped off. But yeah, I'm happy to connect there and figure out, and then we can kind of decide who is the best, what we call champions for the program. The champions are involved with adding residents each new academic year, and residents do receive emails automatically at the start of their rotation date, which is assigned. So they'll receive email reminders from the parenting center to activate their account, complete the curriculum. For residents, there's also quizzes as well that champions have access to, so you can kind of monitor completion and progress and how they're doing. Awesome. Thank you, Amelia. I just saw your message, but yeah, if you do want to have access for your program, your residency program, just send me your email and I'll reach out to you.
Wonderful. Thank you.
And Dr. Hammond mentioned that this is a curriculum for residents, but that the existing providers found it equally helpful. Are all the resources tailored to any level of expertise or any role in the integrated care teams? Can they be equally used by behavioral health clinicians and okay.
Yeah, absolutely. So we do have a variety of different providers that have accounts in terms of behavioral health specialists, I mean, of course, pediatricians, family medicine doctors, nurse practitioners, PAs. It's really meant for everyone. We also now, you can earn 4 hours of CME credit for completing the curriculum as well. So there's an option. We initially were really geared towards residents, but have now, after seeing so much engagement with the resources, expanded it to everyone as well. So the only really difference, if your residency program is enrolled, the champions are able to track progress of the residents and their completion. So that's really the only difference between the account that providers have access to versus champions.
And I have another question related to that one. Do you offer training to programs that are not through this residency connection or championship?
Yeah, absolutely. We actually do have a monthly training, which is, some of it overlaps with, I think, the slides that were shared today, but it's really how to get the entire, everyone in the healthcare space, maximize those moments, maximize the potential to connect with families and promote early relational health. And that's open to absolutely anyone. So we actually have had some child life specialists. We have really a really wide range of staff. What's in Mount Sinai specifically, we've done those monthly trainings and trained over 1,000 different staff members. So I'll share the link in the chat right now on those monthly trainings. And that's really, we're happy for anybody to join those.
That's great. I love that it's not just the medical behavioral health provider, it's any staff that could, interact with the baby or the kid, or kind of model some of this. So that's a cool idea.
I'm just sending the registration link in the chat.
other thoughts or questions, comments people have, similar programs people might be implementing? Yeah, that's a great question about evaluation research. So we know there was at least a kind of maybe a pilot that Jonathan talked about. Is there other data you all are collecting?
Yeah, absolutely. So we are doing evaluation research as well. So we're also constantly looking for if there are any residents or anybody out there who is interested in doing research on this as well, we're happy to work. So we do have monthly meetings where we support research projects at other programs, but within our parenting center, we do evaluate use as well. We have been, and our research manager can speak a lot better than this than I can, so I apologize for stumbling a bit, but we are currently doing research on the effectiveness of the Sparks video series and the curriculum on a larger scale, since our last study was done with the pilot study in 2019.
Well, I'll be excited to hear more about that, and actually interested to kind of follow up about that research aspect. I don't know if I have any other questions.
I'm so curious also to know, I know Lisa was trying to speak and some issues with her son didn't allow her, but I'm so curious about the interface between these programs, Healthy Steps, Keystones, and also for the component of the parent, for the app, for the basics curriculum. I don't know, I think in my head it's all, they are all clustered there, but I really don't know how they interact or overlap or can be used together. Do you have a sense of that?
Yeah, so I think, and also what Dr. Hammond mentioned is when we require the residents at Mount Sinai to all complete the Keystones curriculum, and when we do that first introduction of the curriculum, the most common resources here that are being shared are the Reach Out and Read books. So to kind of partner with that and to share the Sparks resources there as well is there's handouts associated with each well child visit. So we have printouts of that available in English and Spanish. Parent handouts. We also have them in 11 different languages as well, if there are any other languages that would be helpful for your practice. But when we're sharing the Reach Out and Read books, we're ensuring that those handouts are folded into those books as well. And we also place the QR code, like the stickers with the links for all of our resources for families on the Reach Out and Read books. And I know that the observation form that was shared is a really great way for residents to kind of assess and do some self-reflection on their learnings and how they're actually weaving it into practice as well. So I think your question was about other resources as well. So I hope I was able to answer that at least somewhat in terms of the Reach Out and Read books.
It looks like Lisa said Healthy Steps staff members part of development of both programs. So when both are available in practice, P will bring in Healthy Steps if they need more support. That makes sense. Thanks for clarifying. If there are no other comments or questions, we can wrap up. So Sneha, thank you. And thanks to Dr. Hammond for presenting and for sharing your resources. I think we're all really learned a lot and are interested about this program. And for everyone else, we do have a December meeting coming up on, I think it's the 6th or the 4th. So hopefully we will see you all there. And we're going to talk about perinatal screening. So kind of keeping up with the newborn theme here, infant development. So thanks, everybody. We'll see
Rachel,
you.
can I just say something that we forgot?
Sorry.
Remember, guys, that we have a mentorship program. If you're interested in being a mentor or a mentee, just reach out, because we forgot to say that at the beginning. So that's it.
Thank you.
All right. See you
Bye,
also.
everyone.